Hello, Dr. Hill here, another video coming your way. Today we're going to actually talk about orthodontics. I get questions about it all the time. I'm sure all the dentists do, and actually I'm sure a bunch of patients have questions about it too. Number one, when should you start talking about orthodontics? Let's jump into that first of all. Well, to me, I'm a type of dentist that I like to be ahead of the game and kind of have our patients go to orthodontists, especially if they're youth, have them seen by orthodontists so that they can become patients of record so the orthodontist can keep an eye on them. A lot of the times, depending on the crowdedness and depending on the spacing of the teeth for the youth, you're looking anywhere from, honestly, 6, 7 to potentially 11 or 12 getting started. And anywhere in between. Every person is different. I know a lot of general dentists take a lot of extra continuing education classes and stuff to make sure that they can treat youth. Me personally, I send it off to the orthodontist. I feel like they have a really good tell on the youth and the younger age groups. Now fast forward to adults. As an adult, you're never too old for braces. I know I get that question all the time. Well, I'm 30, I'm 40, I'm 50, I'm too old for it. You're never too old for it. I've seen patients as old as, to me, 67. I have a patient that wanted to do ortho and move some teeth. I've seen older patients at orthodontist office do that. You're never too old for it. I do a lot of ortho with the adult population, but I know obviously orthodontists do it as well. So I think you got to figure out what kind of dentist you're going to see and kind of find out their comfort level with potential for moving teeth. Let's go into another subject, types of braces, right? Everybody kind of knows about the old school way with the metal mouth and the wires and the brackets and all that kind of stuff. And then there's kind of more of a new school thought and a new school way with these clear aligners that we're using here nowadays that are very popular. You see them all the time on TV, commercials, marketing, all that kind of stuff. That, depending on what's going on, if you have crowding, spacing, the bite, all this kind of stuff, either your general dentist that you're seeing or your orthodontist that you're seeing, they're going to be the ones that kind of make that call. There's pros and cons to both. Obviously nowadays it's a lot more about aesthetics for patients and appealing to the eye. So a lot of patients really like to go the clear aligner route if they can. But there are certain cases out there that you need the metal, you need the brackets, you need some stronger pull. And that's something that should be decided by your general dentist or your orthodontist, depending on who you're seeing. Like I said, both have pros and cons, and both work great. It's a beautiful thing as to why we can move teeth. Now let's shift to that. Why do you even move teeth? I always have this conversation with patients. In the patient's mind, 99% of the time, all they care about and all they think about is the aesthetics. I want them straight. I want them white. That's it. Now on the other side, you got to look at all the benefits that you get. Number one, the orthodontist, the general dentist, we can align your teeth so that your bite is nice and perfect, so that it's balanced correctly, okay? We can also get your bite into proper function, right? We want you hitting in certain areas. We want you not hitting so much on one tooth compared to the other. We want it to be nice and balanced out. That's a huge benefit that a lot of patients don't realize until they're done with their work. Another one that's big, and we see it all the time, patients that have really crowded teeth, they have a very hard time cleaning them, right? So flossing's hard. They get a lot of buildup. When they go to the hygienist probably brings up moving those teeth all the time on them. And that's a huge positive and a plus once we move those teeth into an ideal form, that you now have an easier job cleaning them, which, to me, I don't even like cleaning my own apartment, so why wouldn't I try to make it easier? It's same kind of thing with teeth. One of the other big things is, let's say you got a ton of spacing, right? Not a big issue unless the bite's kind of off for patients, but it's in the patient's mind, it's a big issue because of the aesthetics. Patients don't like walking around with the big gap in their teeth and stuff like that unless you're Michael Strahan. Shout out to Michael Strahan, great football player. Now he's doing something with TV and all that stuff, so he's obviously has no issues with his spacing, but most people do. A thing that I get asked almost daily about, okay, is these do-it-yourself, at-home, never really see a dentist eye to eye, clear aligners that are now the big rage. You're going to get different opinions on these, okay? To me personally, I'm not a huge pro at-home aligner person or dentist. Call me biased as much as you want, but for me, I've seen too many of those fail, and I've seen too many patients come in extremely upset, disheartened, frustrated, every other term you feel like throwing it, because they were never truly seen by a dentist. And I think when you're moving teeth, you're shifting teeth, you're moving bone, the gums are changing, the bite's changing, the function's changing, all these things are changing, and you're not getting seen eye to eye by a trained professional. It worries me. I get the financial aspect, I get all that stuff, but when you're doing something of being able to move teeth and change all this stuff about you, to me, I would rather go see a trained professional and be able to see them. Right now, I know when I'm doing my clear aligners and when I'm doing my ortho, I'm seeing my patients at least monthly. So I know what's going on. I know if there's problems going on. I know if they're not taking care of their teeth. I know if they're not brushing, flossing, doing all that kind of stuff, which when you're on your own and people are just sending you trays, clear aligner trays from the internet based off of an x-ray, that's worrisome to me. I'm not here to bash or do anything like that. I'm just here to make you aware that you need to think about it before you do it, okay? And I would always say that you want to go to a trained professional first. Allow your general dentist, allow an orthodontist to kind of move these teeth. I think you're going to get a better result and you're going to be a hell of a lot happier at the end game knowing what's properly done. Like I said, I get a ton of questions about ortho, moving teeth, braces all the time. If you guys have more, let me know. Send them here, comment, like, subscribe, do the whole 9. Give me a shout out. I really would love to help answer these questions and kind of make it easier for you. So, till next time.